So to start off with, HoLEP stands for holmium laser enucleation of the prostate. It is a BPH procedure, or benign prostate procedure. People who have troubles urinating would utilize this procedure. And the big advantage of the HoLEP procedure as compared to other BPH treatments would just be the minimally invasive nature of the procedure. It actually mimics the good old-fashioned simple prostatectomy that urologists have been performing for years, and it takes the concepts of a minimally invasive surgery with the maximum benefits of the open prostatectomy surgery. And so as the prostate enlarges, they have more of a likelihood to develop symptoms. Things like slow stream, weak stream, trouble starting and stopping their urination, difficulties emptying. Secondarily, if they are not emptying completely, they can develop bladder stones. They could actually hurt or harm their kidneys. It puts them at higher risk for infections of the bladder, which are very uncommon for guys. And so this procedure removes that tissue and then allows them to urinate where they're emptying their bladder more completely, more efficiently, and really minimizes some of those risks. While using natural orifices, so it's a transurethral procedure. What really makes it shine is it can be utilized in any size prostate, so really small prostates all the way up to really big prostates. And then it works from, rather than the inside out with some of those more traditional procedures, TURP, or other people have heard of a green light laser procedure. There's a steam prostatectomy that's become really popular. Those really start on the inside of the urethra and work their way out. This really starts from the outside of the prostate and works its way in. So you may say, well, what's the difference then? Well, the difference is we're actually removing more tissue. I can find the maximum border of the tissue that needs to be removed and then sort of work from an outside-in fashion. Other procedures, you're guessing when you're done. So with the TURP, you're starting to sort of whittle away from the inside of the urethra, and when you think the most amount of tissue has been removed, then you would stop. So there's no real way of saying this is completely getting all the tissue I want to remove. That leads to higher retreatment rates, and those other procedures may not have the full maximum effect that the HoLEP has. So the biggest outcome is that somebody should expect after HoLEP is actually, improved urination. As urologists, patients have different goals. You'll have guys that'll come in and say, well, I just want to feel like I empty out to completion, or I want to feel like I have the force of a stream when I was, 20 or 30. And that's really, those symptomatic outcomes are what we care about. So if a patient perceives that their urination has been improved, then we're happy. And we're really looking for a 30% improvement in their symptoms, okay? But other benefits that patients will have is they'll have just better force of stream. They won't have to spend as much time in the bathroom. A common complaint guys have is, I step up to the bathroom, I'm there for 2-3 minutes. 3 or 4 guys have come up to the urinal and left. And so that makes them self-conscious, and their efficient emptying, I think, really helps these guys out a lot, makes them feel more confident in their urination. So with any surgical procedure, there's going to be risks. So there's sort of the standard surgical risks, I think, that go along with most procedures, which would be things like bleeding, infection, risks associated with anesthesia. The HoLEP procedure carries some of the same risks as those more traditional procedures like the TURPs or the green light lasers or the steam prostatectomies. Incontinence is always a big concern for guys. Long-term incontinence rates are exceedingly low. We're talking less than 1% after 1 year from the actual procedure. So again, chances of having long-term leakage or needing to wear some sort of pad or underwear liner are exceedingly low. The laser's properties allow us to coagulate small blood vessels as we are going around the prostate and we're doing the enucleation. So bleeding risk is actually exceedingly low. We would find that somebody maybe loses a tablespoon of blood during this whole procedure, so that's very beneficial for them. So this is where the HoLEP has great advantages in the recovery aspect of things. So number one is catheter usually only needs to stay in for 24 hours. So the majority of guys will have the procedure, a catheter will be placed, they'll maintain that catheter overnight, it'll ultimately be removed the next day. This is compared to other BPH procedures which may require the catheter to be in for somewhere between 3 and 7 days. So the other nice thing about this procedure, and specifically here in Southwest Minnesota, is we've turned this into an outpatient procedure, so the majority of people will actually leave the hospital the same day. So very few restrictions are actually placed on these patients. Again, we're not making any incisions anywhere on the abdomen with traditional surgeries. You know, there's usually a large incision which is going to need to heal. So we put lifting restrictions on people, say 4 to 6 weeks, where they can't lift anything heavier than a jug of milk. I think the one thing is I can confidently say to patients, this is going to have a large impact in your life. This is going to really improve your urinary outcomes. When patients are catheter dependent, meaning they have a Foley catheter, that's the only way they can empty out their bladder, we got a really good shot at getting them catheter free long term. If their bladder works perfectly, it's up to 95%. You know, even if their bladder is underactive, doesn't have the squeeze capacity it once had, we still got a 2/3 chance of getting them rid of the catheter long term. I think that's you know, some of the biggest benefits that we can have. And as a surgeon, it's nice to be able to go to patients and say those statistics, and those inspire confidence in patients. I know that retreatment rates are exceedingly low. There's been several long-term studies that have looked at how often do patients have to come back and have something done secondarily. It's under 5% of the time at 20 years. If you look at that compared to the more traditional minimally invasive procedures such as TURP, it's about 1% per year, or at 20 years, about 20% of people are going to need some sort of additional procedure. So it's done endoscopically. So the procedure requires a scope that's placed down the urethra and into the bladder. The scope has specialized features which allow us to dissect the BPH tissue. I think the best way to think about the procedure as a whole is to think about the prostate as an orange. There's the rind of the orange, there's the inner portion or the pulp of the orange. There's a natural border between those two things, and if you were to cut a hole in the top and the bottom of the orange, you could actually feasibly remove all the pulp while keeping the rind intact. Same thing with the prostate. There's an outside zone called the peripheral zone. There's a transition or central zone, which is usually the part that's affecting people's urination. There's a natural border between those two. We can find that. We can use the laser to dissect that natural space, and ultimately that allows us to push the tissue into the bladder. We use a secondary machine called the morcellator, which grabs the tissue and does just that. It chews it into small morsels, and that extracts it from the body. This is all done under direct visualization. So I'm not guessing where I'm putting the energy. I know exactly where the laser fiber is going. I know exactly what tissue is being grabbed during the morcellation process.